Welcome to All Things Manchester, the public access show focused on activities and the people of Manchester, Connecticut. My name is Tom Topping. The engineer today is Dave Smith. We're on Channel 15 Thursdays at 11 a.m. and 6:30 p.m., and then we go into the regular rotation. We're also on our Facebook page, our YouTube page, and you can find us on Cox Public Affairs. Today I'm honored to have a guest that has a lot to offer Manchester's vision for the future. It's Dr. Adam Steinberg. He's the president of Hartford HealtheCare, Greater Manchester Region. Thank you, Doctor, for coming on our show today.
Thank you, Tom, for having me.
It's a pleasure, sir. The first question is it's a personal question. I'd like you to take a minute or two and introduce yourself to the Manchester community, who you are, what you do, and all that. So take it away, sir.
Thank you, Tom. It's a true pleasure to be here, and thank you for inviting me. I originally am from Allentown, Pennsylvania, and moved up to Connecticut 20 years ago, following my training. And clinically, I'm a female pelvic medicine and reconstructive surgeon. And my why is the impact that I could have on people and individuals in my clinical life as a surgeon. But my why now and the role that I have is truly based on the impact that we can have in a community and the impact in such a great community such as Manchester. And really just excited to be here in this role in this pivotal time and transition that the Greater Manchester region is going through in healthcare.
Well, thank you, Doctor. You're beginning a new chapter here in Manchester. So I'd like to ask you what your top priorities are for Manchester Memorial Hospital and the Greater Manchester region, sir.
So we're beginning a new chapter, but we're really building on what a great legacy both Manchester Memorial Hospital and Rockville have had over many, many years, well over hundreds in both. And our focus is really, it's pretty simple. We're looking at our workforce and how do we stabilize our workforce? How do we grow our workforce? We're going to enhance the quality and safety within this region of care that is provided, allowing for greater access for care in multiple of specialties. We're going to embrace and grow and deepen our relationships with the community. Up to recently, Manchester Memorial Hospital was a for-profit institution. It's now a non-for-profit, and we're very proud that we're back to non-for-profit status. And we're building the bonds and the relationships with the community and the other non-for-profits in Manchester. We're also making investments in the people, investments in the infrastructure that unfortunately with the prior owner was neglected. And that's really our focus right at the forefront. We're investing in programming and really what we're trying to do is improve the health of the people of this region, and it is our primary goal.
I appreciate that, Doctor. Thank you for that answer. Maybe you could tell us a little bit about what it means for Manchester Memorial Hospital and the Rockville campus to be part of the Hartford healthcare system.
So Hartford HealtheCare, over the years, has prioritized access, has prioritized affordability, has prioritized excellence. And when we say excellence, providing the highest, safest, highest quality care possible, and making sure that we have health equity and we're providing equitable care. So in our access, we want to make sure that we're providing the highest level of care here in the community. So the people of Manchester and this region don't need to go anywhere. They can get the care right here as they should. But when they need to get care elsewhere, we have those resources to be able to provide that, and we have those locations to provide that. In excellence, we have been recognized nationally by the American Hospital Association in Quest for Quality as one of the top hospital systems in the country for quality and safety. We have been recognized through the Society of Thoracic Surgeons as one of the top cardiac hospitals in the country. This excellence in care we are bringing right here at home, and truly is our priority. When you look at the other hospitals that have joined our system over the years, we have raised the bar in quality and outcomes in every institution. And our region, our system, is one of the few systems in the country where every hospital has been Leapfrog A. And that is an expectation that we will achieve here in the Greater Manchester region.
Well, I'm glad to hear that, sir. That actually leads me to my next question. Because you've been recognized nationally for quality and safety, your most recent position was Vice President of Medical Affairs at Hartford Hospital. 9 years in a row, you were in the A grade for hospital safety from the Leapfrog group. Is there specific targets that you have that are going to bring Manchester into that level of quality for the patients, which we're patients?
So we look at we don't look at numbers. We look at individuals, and we look at every patient they're a consumer, and then when they need to be a patient, we're here for them. And we look at each person individually. So every time there's an infection in a hospital, that's an individual who's having an infection. And what we do is we focus on how do we improve the care for each individual patient when they're in our care. And that's really has been our focus. And we've been recognized by decreasing the amount of hospital-acquired infections in our hospital by over 60% over that period of time that you're referring to. And those are individuals that no longer have a hospital-acquired infection. The CMS gives a penalty to hospitals based upon their hospital-acquired conditions. We in Hartford HealtheCare have not received that penalty over the last 3 to 4 years. And that is something we are going to bring to the Manchester region, the Greater Manchester region. But I'll say, we're going to build on the legacy, because our CMS star rating for this spring that is being announced is 4 stars, which is a very high rating. So we're building, thank you, we're building on something that is really good, and we're very excited about.
Well, when we just met before the show started, and I told you, I go to Manchester Hospital. I'm going to go off script a little bit here and just maybe put you on the spot a little bit, but tell me and my neighbors, if there's an emergency, why our first thought should be, let's get to Manchester Memorial Hospital.
I would say, first of all, thank you for coming to Manchester Memorial Hospital, and thank you for everyone for giving us your trust and care. But I truly believe it's the people, it's the medical staff, it's the nurses, it's all the colleagues. If anyone who's walked in Manchester Memorial Hospital, I will put it up against any other hospital in the region as one of the cleanest. When you walk around and you talk to our colleagues, and my colleagues that are working at the bedsides, that are doing all the jobs in the hospital, there's a tremendous pride. And there's pride in the work that they do, and there's pride in taking care of patients like yourself or anyone else in the community.
I happen to believe that. We briefly discussed that I do have friends that work there. I think I've spoken about it on my social media presence too, that it's the people that have always made the difference. But then I'm going to go back to my more formal questions. I'd like you to tell us more about Hartford HealtheCare's Institute model. What makes it unique, and what services are accessible now to the Greater Manchester community?
So in Hartford HealtheCare, we have 7 institutes, and those institutes span the whole body and every system. And what they do is they allow for the highest level of care and standardization of care throughout the system. Within our medical group, we have over 6,500 physicians, and that allows for a great access. Last year alone, there were 2.7 million visits of patients, individuals, that were seen within our medical group. By having the Institute model that allows for us to bring research, allows for cutting innovation that otherwise would not be possible, it's going to allow us to broaden the spectrum of services we can offer here at Manchester Memorial Hospital and Rockville campus.
Another great answer, Doctor, and I appreciate the thought you're putting into these.
Well, thank you. I appreciate that.
I'd like to ask you now, This is kind of a key question, I think, for my neighbors.
Okay.
What exciting advancements can our community members look out for from Hartford HealtheCare?
So one of our key pillars is innovation and transformation, and we're partnering with companies like Google and Amazon and universities such as MIT and Dimitris Bersimis, who is the provost of AI and the guru in the world of AI, and companies like ADOC and Key Health. And we at Hartford HealtheCare aren't just utilizing new inventions or innovation. We're actually putting it together, and people are coming to us to innovate. And that's what we're going to be able to bring to this region and share. So we could be at the cutting edge. We are making the future of healthcare here at home. You don't need to go anywhere. You don't need to go to New York. You don't need to go to Boston. Right here in the greater Manchester region, we're gonna build on that the same way we've done throughout Hartford HealtheCare.
That's wonderful news, and I'm glad to hear it. This is something I kind of learned just because I follow the hospital Manchester Hospital on Facebook or social media in general. They graduated a class of physicians that, trained there. Is Hartford Hospital going to have programs like for training physicians in the community? And I don't quite understand what the program was. I just saw that they graduated. Is that something that you're going to bring and maybe enhance because of the breadth of you have a large backbone now?
So we have a very robust educational platform, and we partner with many universities within the state of Connecticut and beyond. And it's not just physician learning or graduate medical education with residencies, which we do have at Manchester, and we're very proud of, and we are continuing and considering growing. But it's also other fields such as occupational health, physical therapy, as well as nursing and surge tech programs. So we're going to incorporate that into Manchester, the greater Manchester region, and build it into the portfolio that we have within Hartford HealtheCare.
You also mentioned working with other nonprofits. I'm going to bounce around
Perfect.
now, doctor. Careful saying that. You mentioned other nonprofits that you wanted to work with. And I'd be remiss if I didn't say congratulations on your relationship with the Manchester Road Race. Personally, I think it's a marriage made in heaven. I really do. Would you like to expand on that a little bit, what your goals are?
Definitely. So the partnership with the Greater Manchester Road Race, this is one of the premier road races in the country. Right here in this region. And we could not be more excited. Now, I will admit, and I'm going to do this on TV, I used to run, and I haven't run for some time, but my toes and will be on the line come Thanksgiving of this year. So we will see that. So now it's recorded, so I can't take it back. But the Greater Manchester Road Race isn't just one day. It's a commitment to the community which aligns perfectly with our mission to improve the health and healing of all. And we've already partnered in providing funds to both Connecticut Food Share as well as MAC Charities right here locally, which we could not be more proud of. And that's why the synergy of these two groups coming together is perfect. And our goal is we are here to help support. We're not here to change anything about the Greater Manchester Road Race. And that's truly we are incredibly excited about that partnership.
Well, I was at the luncheon at the country club where that announcement was made. And there was a little bit of an electric shock that went through the building because it is a major announcement. Are there any other groups besides MAC and the road race? I know you've only been in Manchester since January 1st, to be fair. But your outreach, is there any others?
So we're incredibly excited about partnering with non-for-profits, municipal leaders, in the entire community. I was actually at the Manchester Chamber of Commerce gala on Friday night, which they were celebrating 125 years. What an impressive group of people. What an impressive event, recognizing a pillar of this community for so long and the incredible work that it has done to build up business in this area. Our mission is to partner with the communities. That's one of the reasons we came into the greater Manchester region, why it made so much sense. We live in this area. Our corporate offices are in Hartford, right 10 miles away.
Yeah, yeah.
So this is something that we're committed to, and we're committed to it not just here in the greater Manchester, but throughout Connecticut. Again, looking at how do we help individuals? How do we improve health? Health is not just when you come to a doctor or you need a hospital. Health is prevention. Actually, our goal is to make it so you don't need the doctor and that you don't need to come to the hospital, though we're always here for you when you need us.
Okay. You're very good about leading me to the next subject, and I appreciate that. Along the lines of that outreach, Manchester Memorial did have programs. Many of them, like I saw the mothers, they did a lot of prenatal and natal programs. Is the Hartford HealtheCare going to continue that tradition of classes and training and education, outreach to the community in general, and maybe even grow it a little bit?
We are committed to the programs that we have in the greater Manchester region, both at Manchester Memorial Hospital and the Rockville campus. And really our priority is our access. And how do we improve the access of our community to the care that they need where they need it, so they do not need to go far from home to get that care. We're able to provide care not just at our hospitals, not just at our urgent cares, but even in the palm of your hand, in your phone, in our 24/7 app,
Yeah.
where at any time you can go on your app and you could get care as you need it, whether 2 in the bed, or you could be hopefully not driving, but you could be in a car. And we see through that platform over 200 people a day, helping them get care that otherwise maybe they wouldn't or would have been delayed. And so we really are focused on the access of how do we provide the care to the communities that we serve.
You can actually talk to a medical professional through the app?
Yes.
At 2 o'clock in the morning?
Yes.
That is something I didn't know and never actually thought of. I've used telehealth through the VA. Do you want to talk about, expand on that?
So first of all, when I come back, we'll have to make sure, we'll have to look at your phone and make sure you have it on, you've downloaded it.
Yeah, okay, thanks for that.
But essentially, you will go on the phone and there will be some questions you will answer. And then after you answer that questions, they will triage you in a specific direction, and you will have a live clinician in front of you who will ask you questions. And if warranted, you need a referral, you need a prescription of a medication, they will call that in and direct you into the pharmacy. They'll ask you your pharmacy, and it will be done. Okay. And also make sure that you have that referral to go to the next appointment or whatever you need next.
Oh, okay, to me, this is like a discovery, okay? Thank you for telling us about this. And I think it's huge. I can just, because I live alone, all right? That's a huge thing. There are times when I don't know if I need medical help. And I also know that if I do, sometimes it could only be seconds. So you've just educated me and our audience. So thank you for that.
It's also immediate. So at any time, it's not calling for and this is the type of innovation that we're bringing in looking at healthcare and looking at it from a different lens or a different perspective. Traditionally, healthcare has always been based on looking at it from a hospital or looking at it from a doctor's office. Now what we're trying to do is look at it from the patient, the consumer. How do we change the model? Similar to how we Netflix changed the model of movies, or Uber has changed how you get a taxi. We want healthcare at your fingertips.
Doctor, I don't usually let one topic dominate a conversation like this, but I'm going to do it this time because I'm curious myself.
Okay.
Because when I leave here today, I'm going to download the app. Should I prepare for this in advance, sign up with my name and all sorts of background information, so that when the time comes and I'm nervous, I don't spend the first 6 minutes filling out information? Is that logical?
I'm going to say to download the app,
Yes,
and it will give you instructions exactly what to do, and it's very easy. I've used it myself. It's incredibly easy, and it is always available.
Okay. Well, thank you for that. I appreciate what you're doing here, sir. When we were out in the studio, in the engineer booth, we talked a little bit, and I mentioned that I think it's important to get feedback from the community, especially now during the transition from what we had and the vision that you're painting for us this morning, and I appreciate that vision, by the way. How will you get feedback? Will you go directly and say to everyone, like you're having a meeting tonight? Will you do that often? Will you have the community come into you and talk to you directly?
Well, now that we're non-for-profit, which I know I said we were excited, we're really excited about that. We will, on a regular basis, be doing a community health needs assessment,
Right.
which will guide us in one, establishing partnerships, but also listening to our community of what are the needs. And we know health is not just medical, it's social, it's economic.
Right.
And these factors, when they come together, it drives the health not only for individuals, but for families. And that's going to be our priority. And we are going to listen. It's a partnership. It's not just us sharing. It's us listening to our communities and driving, really ultimately, for this entire region, better health.
It sounds really very good, doctor. And I told you before, I was excited because I'm getting positive feedback. But talking to you has really given me confidence that could happen. And I want you to know that's coming from the heart. That's not just something I'm saying.
Well, I
right.
appreciate that.
I knew you told me there was no limits on the conversation. I could ask anything I wanted.
Anything.
I appreciate that because that's exactly what I'm doing.
Okay.
And you brought up something earlier that I think is important. You're a major employer in the community. And I'm not talking just entry-level jobs. You have people, you have the ability to take a Manchester High School graduate and turn them into a medical professional. Do you have plans to do that? Do you have programs in place? So if I came on in a housekeeping, I'm just using general terms to keep it simple. I'm an 18-year-old, I don't want to go to college, I don't want to join the service, not yet. And I get an opening in the housekeeping. Is there a path for me to follow?
So we already in Hartford HealtheCare have partnerships with our local high schools, which we will be expanding to this region. But with Hartford HealtheCare, we don't look at these as jobs. We look at this as a career.
Okay.
And we have many people, as does Manchester Memorial Hospital and Rockville, who their entire career, changing roles, has been with the same organization. So our view and our priority is, how do we grow? How do we take someone who's coming in on their first job and grow it into a career where they evolve where they want to go, whichever direction it is. And there's no predetermined direction of how people want to do. But we invest not only in our infrastructure, but in our people. And we have a people promise for all of our colleagues. And we have right now about 48,000 colleagues throughout the state.
in Hartford HealtheCare has
And Hartford
48,000?
Hartford
Wow,
HealtheCare.
that's about the same size as the state. That's actually another impressive number. See, I appreciate you coming on, sir, because what Hartford HealtheCare means to the community is coming out in this interview. You're telling us a lot of things that we don't know, and I appreciate that.
Well, thank you.
And this is something else that we touched on briefly. Manchester, it sounds like no matter what the reason is, you want people to have confidence in going to Manchester Hospital for the whole of the person. If it's a cardiac event or a broken leg or something, long-term like cancer, that's, you're confident that under your leadership and with the Hartford HealtheCare umbrella, that Manchester will be a general hospital where people can go to get the care they need for virtually anything.
So I think the simple answer is yes.
Okay.
We are building programs. We're expanding programs. But the value that we have in having a system is that we're able to utilize the resources throughout the system. So we have Hartford Hospital, which is 8 miles away.
Right.
And if we need Hartford Hospital, they're there for us. But we're also bringing services here, so people don't only need to go to Hartford Hospital, that they can stay here. And we are going to be growing our services. So if what people need, we will be able to provide them.
Okay. I'd like to add a personal experience here that I mentioned to you. I have Veterans Healthcare, and I had a major back issue that they referred me to Hartford HealthCare. And Dr. Lucarelli successfully treated me and ended a situation that really cost me a year of my life. And I appreciate the fact that your healthcare system was able to do that for me. Doctor, this has been an incredibly wonderful experience. Is there anything you'd like to say before I close out?
I would just like to say thank you. And we know we need to make sure that we are growing and instilling the trust in an organization that has meant so much to so many for so long. And that fundamentally is our goal. And we're on the road, but we know we have work to do, and we're going to be doing it. And just thank you for having me here today.
It was my honor, sir. I made that clear when we met. I'm sure that my audience appreciates it because you were very easy to talk to.
Well, thank you.
I'm not a medical professional by any stretch of the imagination. And I'm very grateful that you came in, and I want to make it clear that anytime you want to come back, just let Eleanor give me a call, and we'll make it happen.
I thank you for that invite.
It's a pleasure, sir. My name is Tom Topping. The name of the show is All Things Manchester. Today's guest was Dr. Adam Steinberg, the president of Hartford HealtheCare Greater Manchester Region. It includes Manchester Memorial Hospital and Rockville General. Thank you for your time, and we will talk to you next week.